So the waits can be pretty significant. It may take somebody at a minimum often 2 weeks to 4 weeks to get an appointment to actually be seen. We try to actually pre-screen charts on those folks so that if I'm thinking that I might want to do testing, I'll get it started even before the patient's coming in to see me to try to cut back on that wait. It really has to do with the clinical status of the patient that I'm looking at and the clinical characteristics. I'm more willing to wait in a young person with a light or never smoking history to wait for the testing. And I think it's a pretty easy sell, especially looking at the different side effect parameters between chemotherapy and some of the targeted therapies, that if I can spare somebody the hair loss and the nausea, vomiting, and those type of symptoms, and not having to come to the cancer center once a week for IV therapy, I think it's worth waiting a couple of weeks to be able to get testing back. If somebody has a high burden of disease, or if somebody has squamous histology or things like that, I clearly just get them started on treatment.